Informed patients are happy patients, and happy patients make your life much easier. We here at Reimbursement RX are constantly being asked how we can help doctors make better financial choices and how we can increase reimbursement. Well, there is not one definitive answer, and I always like to go back to the basics and make sure that doctors understand what it's like for patients, because we need to remember our main objective here. It is to do right by our patients, and that means both medical and financial decisions. So here's one good example of how things work. Let's say you are a surgeon and you just saw a patient whose primary care physician sent to you for abdominal pain. You get an ultrasound, discover gallstones, and schedule her for an elective cholecystectomy for, let's say, Tuesday, because Tuesday is your OR day. So for you, it's rather simple. You start with the patient here in your exam room, and then you take her to OR, and 12 hours later, she's back here. And in order not to complicate matters, let's make this patient a 55-year-old insured woman. You will, of course, bill her insurance, and in a perfect world, you get a payment of X amount of dollars, probably within 2 or 3 weeks. And then 2 weeks later, you get a very angry phone call from this woman asking you why she has to pay 10 times X. And you really don't know what to say. Well, why? Well, let's go back from home to OR back to here. When patients are seeing you, they're in pain, they're unhappy, and they're scared. They want to know how they can get better and if it's going to hurt, whatever it is you're going to do to them. They also want to know how much it's going to cost. But they're afraid to ask because they think you're going to treat them differently, or they think you're just not going to get the same care. And while this is not true, they don't know that. So in this case, this woman got her gallbladder out and you needed help with an anesthesiologist. And then a post-op recovery, her blood pressure went through the roof. Then, of course, you asked for a medical consult, because that's what you do. And a medical consult did what they do best, and they ordered labs, lots of them. And maybe, if they're over anxious, a CT scan. And they also prescribed some medication to help with blood pressure and something for pain. And of course, everything came back normal, and the patient went home. As far as you know, you just bill her and you get a bill for X amount of dollars. And then what happens to her? Well, you are not the only game in town anymore. Remember the anesthesiologist, medical consult, labs, CAT scan, all the medications? All of those professionals bill for the services, and it becomes X plus a lot more X. So when the patient finally gets her bill, it's your charge, which is actually small compared to everything else. And there's all those other charges that she's liable for. And if she has a high deductible insurance with the co-insurance as well, which is the case for most patients right now, she's liable for all those charges. So next time, think about it. Talk to your patients. Tell them there are a lot of hidden charges, some that are outside of your control. Maybe they will ask about different facilities where they can do surgery at, or at least they'll be prepared. They know what they're facing. Informed patients are happy patients, and happy patients make your life much easier. See, now that you know how they feel, next time we'll talk about your feelings regarding that X amount that you have.